Hello, my name is Dr. Flora Waples. I'm the founder and medical director of RESTOR Medical Spa. And today we're going to talk about the top 5 questions that people ask me about injectables. Well, the first question that people ask me about injectables is, what are they? What does that even encompass? Injectables, generally speaking, are medications that are injected under the surface of the skin, but we can do that for a lot of different reasons. The aging process has 3 parts. There's skin aging, which is caused by exposure to our environment, resulting in fine lines, laxity, brown and red spots in our faces. That has to be treated with lasers and topicals. The second part of the aging process is muscular aging. That's when our muscles are pulling at our skin every time we make expressions, hundreds of times a day for thousands of days. We end up with lines in the upper third of our face that are caused by the muscle contraction. They can be solved with muscle relaxation, and injectables are the tool for that. Neuromodulators such as Botox, Xeomin, and Dysport are all injectables. The third piece of the aging process is structural aging. When we are young, we have all this wonderful structural tissue that acts like a scaffold that holds our face up and back. As we get a little bit older, we lose that scaffolding, and as a result, our face will kind of slump, if you will. We get hollows under our eyes and lines around our nose and mouth. Those losses of structure are treated by rebuilding those lost structures with dermal fillers or biostimulators, both of which fall into the injectable class. So, to answer that question, what is an injectable? An injectable is a tool that we can use to solve the muscular aging and the structural aging of your face. The second most common question I get asked is, why do we need injectables? Well, that's a very good question, and there's a very simple answer to it. The surface of our face, the skin, can be treated with lasers and topicals and things that don't need to go underneath the skin in order to rejuvenate it. But all of the aging that takes place underneath your skin, the aging of the muscle, the aging of the bone, and the structure of the face, those parts of the aging process can't be treated from the surface because they are not on the surface. They're underneath, and that's what you need injectables to treat. Neuromodulators like Botox, Xeomin, and Dysport help with the muscular lines of aging in the upper face, and our dermal fillers and biostimulators can help lift and support the sagging and hollowing that happens in our lower face as we age. The third question that I get about injectables is, how do they work? Well, the answer to that is as varied as the different kinds of injectables. The neuromodulators, Botox, Xeomin, and Dysport, those medications that we use to control the lines of the upper third of the face, act by relaxing the muscles. When the muscles are not pulling at the skin anymore, the lines go away. The dermal fillers and biostimulators, the treatments that we use to treat the hollowing and sagging and folding of the lower face, act by supporting and propping up and rebuilding the lost structure that gives our face that scaffold that holds it up and back like we want it to. So the way they work varies with the type of medication we use. The fourth question about injectables is, how do I know what to get? Well, that's a great question. You probably won't, because there's hundreds of different kinds. There's entire fields of medicine that are devoted to the study of these. But you know where you can get the answers, and that's here. Come in, talk to one of our senior injectors. They will give you a roadmap and a guideline as to what injectables are right for you and what's going to get you to your goals. The fifth and last question in our top 5 is, when should I start? It's a great question. Like any great question, there's lots of answers. Generally speaking, the lines from the muscular aging in our face, the 11s here, the lines across the forehead, the crow's feet around our eyes, will start to appear in people's mid-30s on average. So if you want to treat those, mid-30s is the time. However, that's when they appear, but that's not when they start. If you want to prevent, starting in your mid-20s is the right thing. You can prevent those lines from ever forming by using a very, very light dose of something like Botox or Dysport. So you start, whether you want to prevent or whether you want to treat, depends. Same thing is true with dermal fillers for the hollowing and sagging of the lower face. That part of the aging process typically doesn't start until the 40s. But again, when you see it is not when the process begins. So if you want to do prevention, I would start with something like Sculptra in your 30s to nourish and support those supportive tissues of the face. Then in the 40s, that's when we start dermal fillers to rebuild any structure that you've lost. So when you start is really up to you. And those are the top 5 questions that people ask me about injectables.